Hi folks, how you doing today? This is Dr. Talorico. I want to take a few minutes just to talk about what a good thyroid panel looks like and what tests you should get or what tests you should ask for when you go and have your thyroid evaluated. Typically, when you get a thyroid evaluation, it consists of two things, the TSH and the T4. And those two are kind of like the routine, the standard tests. But if you're already, been told that your thyroid is normal or you just don't feel well and you got these tests and they're both normal, here's some other things you need to consider. One of the first ones is called free T4. Free T4 just tells you it's basically a marker that says how much thyroid T4 thyroxine is floating around in your blood that's not attached to the binding globule. So they have this thing called a protein. It's a thyroid globule. It is basically a protein that holds on to thyroid. So if you have a lot of free T4, that's a totally different thing than a total T4 number or just a T4. The same thing with free T3. So we want to know how much of this is readily available to interact with the cells. And then we'll go back to this in a sec. These are antibodies. So if we know that you're not feeling well, you have hypothyroidism, you're having trouble with energy levels, and this is like a habit, even though you're taking maybe Synthroid, you're taking other medications, these two tests really will tell us if you have an autoimmune problem related to the thyroid. So you have thyroglobulin antibody, and then you have TPO antibody, thyroid peroxidase antibody. Okay? These are important because if you have an autoimmune thyroid, it's a different situation than if you just have a hypothyroid, because this is immune system primary. T3 uptake and T4 total are ratios of what's bound versus what's a total amount. And so these kind of tell us the dynamics of what's going on with the thyroid. And they're pretty interesting. Now the other thing is this is called reverse T3. Reverse T3 is made from T4, and it is made when the body's under stress. So when the body's under a lot of stress, it actually deactivates or energizes you in a sense to save resources. So if you're sick, for example, you may have a high T3, or if you're under a chronic stress, you have a very stressful situation, a very stressful job, very stressful lifestyle, it's not unusual that you're going to run a high T3 reverse. And your body doesn't need the mineral selenium to make reverse T3, but it does need the mineral selenium to make free T3 from T4. T4 is more of a signaling hormone. It's not very active, and so T3 is 8 times more active than T4. But T3 is synthesized by an enzyme, deiodorase. My handwriting's bad. But anyway, there's an enzyme here, and this enzyme requires the mineral selenium to be done. In this case, reverse T3 can come from here, and it doesn't need selenium. So selenium is really important on some thyroid function. A lot of the foods that are really rich in iodine also are rich in selenium, like seafoods and kelp and all these seaweeds and things like that are rich in both. A couple other tests to consider is the cortisol, because the cortisol, especially if it's high, can block the conversion of T4 to T3. DHEA is also important because a lot of times when somebody's DHEA level is low, it means that they have inflammation. And then ferritin is the main protein that deals with iron, and you need iron to make thyroid peroxidase, which is an enzyme that's important in moving back and forth through thyroid hormones and synthesizing thyroid hormones. So this is just a more comprehensive panel. This will tell you a lot more than just getting these two. And there's a lot more to be said here, but just for the purpose of this is where I want to leave it, because you can get a lot of information from these tests and then just have somebody who does more of a functional assessment do the interpretation. So, okay, thank you. So just in addition to getting those tests, there are ways to get tests done on your own. In fact, I have a portal now for my patients where they can log in under my name, my Dr. Talorico, with this portal, and they can order tests on their own. And that's very helpful because your physician may or may not want to order the tests, or maybe they don't understand why you want it. But you're the master of your own health. So if you want to order a test, you order a test. You can do it at a discounted rate, and I'll put that link in the description here at the bottom of the video. Thank you.